welcome back to my channel. I am here with Dr. Nix. As you all know, I'm Dr. Mondragon. She has a beautiful office in Orlando, Florida. She's gonna allow us to film her treating me. You guys have never seen Activator on my channel. You've never seen acupuncture on my channel. So chiropractors, actually, if they take extra hours, they can be certified to perform acupuncture. I've never had acupuncture, but I really, really trust Dr. Nix. We'll do a great job.
We'll have a good time.
Okay.
And we'll start with an exam and then do some history and get you treated.
Okay, yes,
All right.
I'm excited.
Come on over. Thank you. All right. Perfect. So we'll start there, and then I'm going to go ahead and take your temperature. Looking good. No fever, nothing. Perfect. Nice. Okay, let's go. Perfect. Okay. There you are.
Good?
Yep.
How tall am I?
Good.
Everybody wanted to know my height.
Oh, really? You are 66.5 inches. So that's 5'6" and a half.
6.5.
Yeah.
I'm not trying to put you on the spot.
Yeah.
Do you have like a wellness schedule? Like, what would you recommend somebody that didn't really have any symptoms?
Yeah.
You know,
So
wellness care.
we would usually do more like once a quarter. That way, because in Chinese medicine, we focus a lot on the shifting in seasons.
Okay.
Yeah. And so it's really fascinating because the Chinese medicine elements, which I keep pointing to this chart because
Yes.
it's really cool. This is the NET chart, the Neuro Emotional Technique.
Okay.
And it goes over the different acupuncture meridians and then the different elements that they're associated with, as well as where they might show up in our body. So let me just kind of give you an example.
Okay.
If we have like shoulder pain, it might be because there's some sort of blockage in the lung meridian due to something like grief. So I had a patient in particular who she was seeing this phenomenal chiropractor who I actually had wonderful training under. And she'd been to all these physical therapists, was doing all of these other types of treatments, and just wasn't getting any sort of relief. And it's because she had grief trapped there from high school, and she was in her 40s. And so anyways, we did our neuro-emotional technique release, and no more pain. It can show up, these types of emotions can show up a little bit more often during specific times of the year. And actually on my YouTube channel, on the Healing and Wisdom channel,
Go ahead.
yeah, we go into that a little more in
Okay.
terms of the element. Let me know if pain or discomfort are with any of things. So just going into flexion, good. Okay, back in the middle, okay, extend, good. Wow, you've got some.
I warned you.
First start off with going down. You've got any discomfort there? Okay,
No.
good. Come on back up. Okay, and then go ahead and extend. Nice.
How far
there's
back do you
that neck. No Gumby moves here. We don't need that. Going and bringing the fingertips towards the knee. Perfect. Good. Okay, and then the other side. Nice. All right, and then we're going to go back in the middle, and then we're going to rotate. So, yep, and then back in the middle. Okay. And then any discomfort with any of those. Awesome. Okay. So what we'll do, we'll hop up here. I love your extension. Man,
Oh,
I
yeah.
think you win. I think you win.
That I can go all the way back.
Okay. Any discomfort there?
No.
Okay. With anything.
So you might hold them there?
And then you can just bring them back down now. Perfect. Good. Anything there?
No.
Okay, so we're going to do a couple checks for just cranials, and if the atlas is anterior, and then everything else we're going to just do the activator protocol.
Sure.
So you're going to have your arms back to back to start out. Yep, just like this.
Okay.
And you're going to keep them together. I'm going to try and pull them apart, but don't let me, okay? So we're just going like that. Awesome. And then just opening the mouth just to check how the cranials are doing. Let's try that again. Got a little bit of hopping, so we'll work on that.
Okay.
All right, and then tongue out. Okay, good. Awesome. Atlas is looking good in terms of not anterior. So that's where it's not pushing on, the brainstem.
Right.
We're going to use a little bit of oil that has some frankincense in it. And we're going to start with putting that behind the ears first. Then we're going to go ahead and just bring it a little bit down the neck on both sides, across the forehead, and then on the top of the head some. Awesome. So nice deep breath in and out. Perfect. Again, in. Nice, and out. And last one in. that's for that top thing, or that one behind the ear. We'll go now to the parietal. So again, deep breath in and out. Again in. And out. Beautiful breath. You seem like you practice. Good. Nice. Okay. Good. Awesome. And then 2 more. Good. And last breath cycle. Good. Perfect. All right, we're going to do our muscle test again. Okay, keeping them together. Good. And then one more time. Perfect. Nice. No more hops. Beautiful. Okay, so what we'll do next, now we're going to do the activator protocol. Okay? Lying here, face down, but you'll first start on the platform, and then you'll be holding the side handles there. Perfect. And then when it goes down,
We were here.
perfect. When it goes down, you're just gonna let your body lay still. When it
Do you want my head here or on
Yeah.
the side?
Yeah, you can have it there.
Okay.
Just so you feel like, just that you've got something to hold on to. So we'll go down. And the reason why we use this table in the activator treatment is so that we don't have any sort of leg discrepancies. It looks like you're about 1/2 inch shorter here on the left. So not a huge difference. If you want, you can come and see. So this is, you can see just about 1/2 inch shorter than here on the right side. Then we're going to look at the second angle here. So we're going to come on up and see, where do you go? You actually go even, which is awesome. So let me go ahead and show and tell for the activator. So this is what it looks like. So we're going to start here on the joints, and we're going to be doing some muscle tests. So we'll just be swiping along, and then I'm looking to see, does it create a leg change? Okay, so we do have a little bit of a change even here on the inside of Dr. Mondragon's knee. So we're going to first work on the ankle here. We're going to click. Good. How'd that feel?
Fine.
Pressure is good?
Mm-hmm.
Awesome. Okay. All right, so I'm going to stabilize your sacrum, and then we're going to do a straight leg raise. So just starting with this left side as high as you can. Awesome. And then back down. And then let's compare it to the other side. Okay, good. All right, so was one side a little easier than the other?
This side.
That's what it looked like. Your SI joints first. And then we'll work on the sacrum. So we're at a 4 setting for this region, because the sacrum is a bigger, more substantial joint than like our neck is. So
Yes.
yeah. All right. So what we'll do is we'll come from stabilizing there. We're going to raise the legs again and see if we have any changes. Okay, good. And then back to that right side. Okay, good. Getting closer. Were you still feeling a little easier on that right side?
It felt easier on the left.
Oh, good, good. Okay, so already seeing some changes there. Perfect. So what we're going to do, I'm going to go ahead and just check to see if there's anything else with the sacrum and the SI joints that we need to do in terms of creating some evening effects. So I'm going to check the bones that you sit on. So it's going to be gentle pressure like that, but on that bone that you sit on. Okay?
Yep.
Awesome. So we're going to start on the left side on that bone. And then that looks good. And then we're going to go on the right side again on that bone that you sit on. Okay. So you look good there. Awesome. SI joints and everything, that's all cleared out.
Okay.
Yeah. So we'll put the left arm on the low back. Perfect. Good. And then we're going to come on up and see. Okay, looking even there. Let's go ahead and swap arms. Nice. Okay, good. That does help lengthen you on that left side. So we're going to do a little bit of work on that L4. It's rotated left. Let's do both arms on the low back now. Okay, good. All right. So a little bit of rotation there towards the right with L2. So what we'll do, you can relax your arms down by your side and go ahead and change the setting. Now it's just the vertebrae are smaller than the sacrum, so we don't need it at that level 4. but we're working on that left rotation there. Awesome. How's the pressure for everything?
It's great.
Okay, good. Awesome. All right. Go ahead and put that left arm up by your head. Nice. Okay, good. So from here, that looks good. Nice and even. Let's do both arms up there. Okay, perfect. Nice. All right, and we've got a little bit of right rotation at T8. So you let me know if the pressure is good. That's okay?
Yes.
Awesome. You giggle, huh?
Well.
You're used to really good up, right?
It's still powerful, the
Right,
activator.
right, yes. It makes those changes as we've begun to see already with the leg length differences, both in your heights and your sensations too.
Oh, yeah.
All right, go ahead and turn your head to the left. Okay. Good. Perfect. Then we're going to shrug the shoulders up to the ears. Yep, you got it. And relax again. Okay, good. That looks good. And then roll the shoulders down to me. You got it. Very nice. All right, perfect. A little bit of right rotation there. Go ahead and squeeze that left arm into your side. Perfect. And relax. Now we're going to look a little bit more at the upper extremities. That's actually looking really good. Go ahead and squeeze this right arm into your side. Perfect. Nice. Okay, we'll work a little bit on this shoulder here. Go ahead and put your head back in the middle. Nice. Lower setting. Okay, nice. And then here we are in the T4 region as well. So we're working on both the vertebra and the rib. So we'll go ahead and I'm just going to work a little bit here on the shoulder. Okay. And then we're going to work on your scapula, just on the external rotation or lateral rotation there. And also on the shoulder, and a little bit also on the elbow and wrist. So we'll work here on the elbow. Okay, you had a nice reflex there.
I know, I'm
You
very
felt-
nervy.
You felt fine with those though?
Oh, yeah.
Awesome.
I very sensitive reflexes.
Okay.
I have a little bit of
Hyper reflex.
yeah, but it's like throughout. So
Okay.
it's normal for me.
Okay, nice. Good. Okay, so what we'll do, we're going to check out the neck now. So just
Sure.
lift the head up, look at the wall, and then back down. Good. All right. You're looking good there at that C5 range. Go ahead and tuck your chin toward your chest. Okay. Perfect. Okay. Good. And right there. Okay, nice. Equality there. So both sides are the same, and then we'll come up to that second angle, just see where we're at there. Perfect. Same thing. Nice and even. You are alive!
Yes.
You're alive!
Very much so.
Good. And relaxed. I have had a couple people fall asleep on it. Have you ever had? Well,
Yes.
Okay, yes.
Even
So
as
relaxing.
aggressive as I am,
I wonder, yeah, if you actually
they
did.
fall asleep.
People do tend to have the raccoon eyes after.
Yes.
That is a thing. Yeah.
All right.
All right.
So what's next?
Okay, so we're going to go ahead and do the acupuncture. So
Okay.
what we're doing when we're doing acupuncture is we're focusing on the meridians, which are the channels in Chinese medicine
Okay.
that have to do with not just the musculoskeletal area that they're traveling, but also some with the organs that they're related to. So like, for
Okay.
example, this is the bladder meridian, and that's really in
I
charge of
hear-
the back, the
Yeah.
activator side, and then this just,
They go together, it seems like.
They really
very
do.
much so.
yeah, they really do. So I like to use what's called the roller table. So we'll go ahead and bring this up, and basically what this will do is it's going to turn on, kind of like if you've been to the spa and had your nails done, there's the massage table, right? But this is, you know, where you're lying down as opposed to seated, and it's helping to stimulate the meridians along the back. So the bladder meridian in particular. I'll
Okay.
get you some face paper there for your head. Okay. And then you'll lie face up, and it'll feel like you're kind of moving into that little hole there. Yeah.
Okay, so I'm kind of going like this?
Yep, and then you'll scooch up some just so your head is actually supported on the pillow. Perfect. Good.
Alright.
Awesome. And then I'm going to put this underneath your knees, and then I'll have the roller table on, and we'll just do this for the acupuncture pulses. Basically, we're checking 3 points on the inside of your wrist, and we're just getting a snapshot of that whole channel just by holding over these specific acupuncture pulse points. So right now we're holding over the lungs and large intestines meridians, which those are more along the arms, the channel, and you're looking rather good there, a little bit weaker there for the lungs, so we'll definitely be working there. Stomach's looking good. And then spleen. So I'm just holding gentle pressure, and what I'm looking for basically is if you're hyper, or like just a really pronounced pulse, then I know, okay, we need to help tone that down. And then if it's more just like barely even noticeable, I know, okay, we need to help stimulate that so that that circulation can actually be restored in that channel. Stable. Awesome. Okay, so now we're here on the small intestines and heart meridian, and you're looking rather good. Yeah, some good normal pulse there. Nothing hyperstimulated or just barely going on. That's good to see. So for the liver and the gallbladder, there's actually some pretty good movement there. So good. We're good here. So we're going to actually hop over to the other table. Smell and choose. Choose your oil for the day. So I'm going to let you pull and
Smell
see
it.
which one you like better. So we've got more of a lavender floral and then more of a cinnamon type of.
I guess this one.
Okay, perfect. Great. And again, some of it is for in the hands. That's going to be more for small intestines and heart as well as the lungs. And then from there, we'll do. So most of what I do is on the top of the feet, because that's where most of the points are for where the acupuncture meridians start and end. I am going to put a little bit of oil on the bottom of the feet. It does tend to get absorbed into the body best when we have oils on the bottom of the feet. So from there I just do a gentle tap. And for the most part, that's all you'll feel is really the tap. The needle itself, sometimes, like I said, you will feel just depending on if that channel is more blocked. But for the most part, like I said, you just don't even notice it.
Okay.
So, yeah. We'll first start here. So, I was going to say, most of the time you won't even feel. Like, it's just a tap. So, it's just a gentle tap there. So, we're going with each of the different points for different meridians. So, these are more for that those gallbladder and liver meridians. And then here we're working on the stomach. And then we're going to work on that bladder meridian. So this is the one that's more for the back. Okay. Ooh, you did feel that one. Yep.
Yeah.
Some of the ankle points can be a little bit more sensitive.
I didn't feel the first one.
Yeah.
I felt the second one.
Yeah. So how did that feel? What did you experience? Kind of like a
there's
zinger?
The one that I can still feel right now is on
Okay.
the second toe.
Okay.
That one's like itchy or something.
Yes. So what's really fun?
Like that one I want to like scratch.
Yes. Basically, what happens is sometimes after, like you've done a vigorous workout, you can have that sort of itchy sensation within your muscles because there's extra circulation there. There's been a lot of nerve impulse firing as well as more blood flow flowing to that area. So when we're doing acupuncture, we're really working on the circulation and helping to improve the circulation throughout. And so that's why you can have these different types of sensations. So especially the itchy is a common experience.
Yeah, I don't feel it there on the same spot.
Okay,
The other one, you know.
Yeah, it is interesting. We do have unique sensations at different times on different points. So, perfect. Good. How are you doing?
Fine.
Good. Nice breathing.
I just think it's fascinating how they're different. You're on the same point,
Right.
on both feet.
But
They feel different.
Yeah.
Each point has its own sensation, let's put it that way.
Yes. Yes. So, yeah, there are, within the channels, we can have different areas that are more blocked than others. Doing awesome. Good job. So now we're working more on some of the hormones as well as
Okay.
even a couple of pain-related points. And then even for some of the digestive types of things that you've had. Okay, so we'll do a little bit here for the lung as well. Good. All right.
This feels like nothing compared to the feet.
Okay, good. Yeah, yeah. So
Like
you're
it's
not as blocked in those regions.
like a porcupine.
The funny thing is, everyone always thinks like, am I gonna come out of here looking like, yeah, a porcupine? But for the most part,
That one was sensitive.
that was a heart point. So, and that does help with sleep. So,
Lachlan. I'll blame it on him.
there you go. We're gonna go ahead and do a little bit more for the hormones. So this side's a little more sensitive. Yeah.
Yeah. I'm glad you didn't warn me. I was like,
Oh, yeah.
oh,
it can
back
vary.
to not feeling anything.
Okay, good, good. Yeah. Yep, that does happen. Again, you were more blocked on those. What are you feeling? Like a
Just like
pressure?
Ball,
Yes.
but like it's coming through my hand.
Okay, That's
Like,
awesome.
oh, I don't know if I want
Whoops.
to move my hand.
Let me go ahead and help you place your hand. We're gonna go down just a little. There you go. Is that better?
Yeah,
Okay.
I'm fine. I'm just
Okay.
like, remember that itchy feeling?
Yes, yeah. You're
It's-
starting to feel that.
On that side, yeah.
Ah, okay, good.
But only there.
Some extra circulation coming in there. All right, going for the head, that third eye point.
Botox, I'm just kidding.
Actually, acupuncture can help with some facelifting and rejuvenating type of looks, because think of like our stress. We tend to furrow in areas where we
yeah.
stress, or hold tighter where we stress.
Mhm.
And so with acupuncture, because it has that stress relieving component, it can help relax those muscles.
Okay.
So yeah, some anti-aging support. Good. You doing all
I was
right?
a little sore.
Was that a little tender? Okay.
Thank
Thank you so much. Okay, and then we're going to do a little bit for the ear, since you have mentioned that you had some ear
Want me to
ringing
turn?
and stuff. Yeah. Okay, right there is good. Okay, good. And then last one. Perfect. All right. And then what we're going to do, I'm going to go ahead and go through and just stimulate them just a little,
Okay.
just to make sure they're in the right position. You doing all right?
Yeah.
Good. Okay. Awesome. Okay.
Yeah, I don't feel itchiness in there anymore.
Okay. Good.
It took a little bit to subside.
Yeah. It's now your body has moved through some of those blocks. So when you're lying here, you might have different sensations. Some of those sensations might be like what you've already felt, kind of like that zinger with the first one. Usually it doesn't once everything's already in, but every now and then it does. Sometimes there's pressure. So for example, you might suddenly start feeling like pressure right here, and then it goes away, and then it just moves over there. It's again because your body is identifying areas where it's blocked and now pushing that out of the way. So the way I like to kind of explain it is that, like, as if you're thinking, if we're working on these channels as a river, right? So if with a river, if a log has fallen and now is creating a dam in the middle of the river, one of the ways that we can help move that log out of the way is increasing the force behind that log and increasing the pressure behind it to move it out of the way. So that's what we're doing, is we're creating more focused areas where your body can be able to identify, okay, these are where I've been blocked, now I can help push that out of the way by having the acupuncture stimulation and improve circulation in these areas throughout your body.
Okay.
Yeah. Oh, I almost forgot your abdomen. Don't let me forget. So let me go ahead and do that. I'll let you rest. So rest is an important part of acupuncture. And then again, covering the belly button.
Okay.
Gotta keep the chi in there. So working here, good. Okay. So with rest, it actually allows your body to begin to scan and identify, all right, this area is blocked, we need to focus on this. So that's why you'll feel possibly, like everyone has different sensations. But one of the more common ones is that pressure, where kind of like what you were describing, that ball feeling, that can happen because your body is now scanning while you're resting and moving those blocks out of the way.
Okay.
So you're able to relax and your body just does the work without you having to push it into gear or anything like that. It's just a beautiful concept of really letting your body take care of itself.
And so, like, I moved my thumb and it like zinged me.
Yeah, that is true. You
Okay,
can.
Brenda, don't move. Wait, how could I like put my arm?
Relax your hand.
Hold on,
Here.
I think I did something to that one.
No, it's good. Yeah. Here, if you want, I can help lead you.
Yeah.
There you
Okay,
go.
Brenda, don't move.
Beautiful.
All right.
That's your sweet spot.
Okay.
Relax. Nice. All right. Ring me in if you need anything.
Okay. Definitely different. Okay, I was just supposed to be breathing here while I'm stuck with a million pins. Okay. Like you can't move. I mean, you can move, but
It hurts.
I'm so nervy, like sensitive. Yeah, it's like I feel, okay, first of all, in between my forehead feels like a lot of, like wherever this yellow one is right there. I feel nothing on my abdomen. Am I covering them?
Yeah.
Well, I think she wanted to. They're not going to come out.
Oh.
But the right hand, I feel nothing. Like it feels normal. The left hand, I feel like a lot of pressure in my left hand.
Maybe because you're dominant on your left hand.
I don't think it was that. She said it was due. I'll have to remember what she said. But then it's still the left foot too.
So on the left side.
The left side, yeah, definitely.
Okay, so for the left hand, let's see, which specific points? Is it in here on the
Yeah,
outside?
and
Okay.
the same thing on the other side. I almost feel like a line is being drawn across my wrist.
Awesome, yeah. Oh, okay, yeah. So right here, this is the heart
That's
point.
the most sensitive.
Okay, yeah, that's a heart point. And then here's the lung point. And so they can be just working together and helping to release some of those blocks that have been there from
Okay.
both the heart and the lung, from some of the different symptoms that you kind of mentioned to me earlier.
Right.
So one of the interesting things with qi, so that's the Chinese medicine term for basically like energy, circulation, these sorts of things. So one of the textures that qi comes in is the form of pressure. So oftentimes it's like a
Okay.
deep ache.
That
That
kind of.
yeah.
It feels just like pressure.
Yeah. So it can have a variety of different forms. It can be the pressure, it can be that ache, it can be the zinger, actually, where it just kind of opens up the channel real quick. That was what
Okay.
you had more
My
on the
toe.
ankle. Yeah,
my ankle, that's right.
Right, yeah. Sometimes it's that itching, and then even sometimes the temperature changes. Right.
The foot is like maybe like what you're saying, ache.
The ache, okay.
But the only one that I feel in the foot right now is that middle, whatever this one is right here.
Okay, so it could be either, is it
That
that
one,
one? Or,
yeah.
Okay, so this is a liver point. So it goes hand in hand with the gallbladder. Each of the different meridians tend to have like a husband-wife pair. That's
Okay.
what they call it in the Chinese medicine. There's the yin and then the yang. So they just go hand in hand, and they have different properties. The yin's more like the nurturing side, the yang's more like energized and active. So
Wow. Okay.
yeah, there's a lot in relation to Chinese medicine. So yeah, so we can experience some of those different sensations. But that's wonderful. I love actually seeing when there are sensations that you're noticing.
I don't feel much on the abdomen. The
Okay,
abdomen, I want to say, was
good.
like the least.
Okay, I've noticed that actually for most people. I've rarely had anyone have like, I've never actually had anyone with a zinger
A zing on their stomach.
on the stomach. Yeah. Yeah.
Yeah, I mean,
It
now I feel a wave going down my arm,
Okay,
like towards my elbow.
Awesome. So let me tell you a little bit with like my experience of why I chose to do acupuncture, if you'd like. It was kind of a similar sensation. So I tend to be like a mindful, meditative, prayerful type of person. So before I do anything, I like try to really go in and think about that. And so as I was doing that, I was thinking like, okay, do I want to do this acupuncture thing or not? I hadn't experienced it either. And as I was kind of in that state, I actually felt this sense of like this prick. It was on that left side of the arm, and it had that kind of pressure, and then it was a warming sensation as well.
Yes.
That went up the arm, and then went up my neck, went up my head, and then just kind of spread throughout both sides, both arms down. And I just felt really rejuvenated, energized, and like my cells were awakened. It was just like a really interesting sensation. I'm like, if this is what I can be able to do in any sort of form, like even if it's not that full type of experience, then I'm doing it. Like I definitely want to be able to be a part of helping people physically and just feel that sort of like internal rejuvenation. So that's awesome.
I'm wondering if it's this.
Yeah, and that does go along with what you were talking about with how you had that radiculopathy experience down that arm. So
it doesn't hurt at all coming out.
yeah, good. Usually it doesn't. What's interesting though, sometimes the points, it's again that innate intelligence that the body has. The body will actually hold on a little bit tighter to points that it's not done yet. So, and then the opposite is true. Once the body's done with a certain area where it's like totally no longer needing that stimulation, it pushes it out, and then the needle rolls off, and it's it's up to me to go and find them. But it's yeah. So it's really fascinating how innate the body and the innate intelligence works within the body, both in the chiropractic side and the acupuncture realm as well. So awesome, you're doing great. Okay, and then we'll finish off with the points on the head. Now you can move your arms a little bit more. Yeah. So you'll see that there are a couple points where there is a drop of blood that comes to the surface. Those areas were more in particularly blocked. That we call in Chinese medicine that those areas were more stagnant. So we can see especially in the ankle and in the feet here, especially that liver point that you were feeling. I like to do a little bit of seated cat-cow to help release some of the pressure from lying down for a while.
Okay.
So you'll just do kind of with your hands there on your knees. Just gonna kind of go forward, nice, and then coming up, and then if you even want to like extend with your arms, just kind of doing a counter. Perfect. Yeah, you with your extension. I love it.
Awesome. They make fun of me a lot for being, so extra with it.
Yes. Do you have some water here for you? Good. Any other questions that you guys have?
No, the acupuncture was definitely the most interesting.
Yeah.
Because I've never had.
Right.
But what I noticed with the activator
Yes.
is you told me to tuck my chin.
Uh-huh.
And when I first did it, I was like, ow. I mean, you told me you did range of motion.
Yes.
I didn't feel it there, but when I tucked it, I was like,
when you were lying down.
Like, okay, there's tension there. And then you clicked it, did it again, nothing.
Oh, God.
So it's fascinating.
Beautiful. That's awesome. Yes.
Cool. Thank you.
Yes, definitely.
Thank you.
Oh, my goodness.
Okay, letting us
Yes.
film and opening up your office to
Yes.
us.
Oh, my goodness. It was a joy.
So thank you.
Yes, yeah. To share with you some healing opportunities because you're doing so much healing. So healer, heal thyself, right? That motto. as well as just sharing other opportunities for different types of modalities of activator, acupuncture.
Very cool.
Yeah, yeah.
So thank you.
Oh,
Thank you.
yes, yes.